Good day, everyone. We are Group 1. We will discuss today about celiac disease. I'm Nairine S. Mantawil, and my member is Sandara G. Mantawil, Noveno Crizel, and Ninkay Aaron. So we will start. Celiac disease is a serious autoimmune disease that occurs genetically predisposed. People where the gestation of gluten leads to damage in the small intestine. It is estimated to affect 1 in 100 people worldwide, but only about 30% properly diagnosed. When people with celiac disease eat gluten, protein found in wheat and barley, their body mount an immune response that attack the small intestine. This attack lead to damage on the villi, small finger-like projection that line to the small intestine that promote nutrients absorption. When the villi get damaged, nutrients cannot be absorbed properly into the body. Celiac disease is a hereditary, meaning that it runs in families. People with first-degree relatives with celiac disease, like parents, child, siblings, in have 1 in 10 risk developing celiac disease. Celiac disease can develop at any age after people start consuming gluten. Left untreated, celiac disease can lead to additional serious health problems. Cause of the celiac disease. The intestinal damage often causes symptoms such as diarrhea, fatigue, weight loss, bloating, or anemia. It is also can lead to serious complications if it's not managed or treated. In children, malabsorption can affect growth and development in addition to gastrointestinal symptoms. There is no defined cure for celiac disease. But for most people, following a strict gluten-free diet can help manage symptoms and help the intestinal heal. Symptoms of celiac disease. The symptoms of celiac disease can vary greatly. They also may be different in children and adults. Digestive symptoms for adults include diarrhea, fatigue, weight loss, bloating, and gas, abdominal pain, nausea and vomiting, constipation. However, more than half of the adults with celiac disease have symptoms that are not related to the digestive system, including anemia, usually from iron deficiency due to decreased iron absorption, loss of bone density called osteoporosis of softening of bone called osteomalacia, itchy blistering skin rash called dermatitis hermaphroditus, mouth ulcer, headache, and fatigue. Nervous system injury, uh, including numbness and tingling in the feet and hand, possible problem with balance and cognitive impairment, joint pain, reduced functioning of the spleen, known as hyposplenism, elevate liver enzyme. Children with celiac disease are more likely than adults to have digestive problems, including nausea and vomiting, chronic diarrhea, swollen belly, constipation, gas, pale, pulse, smelling stools. The inability to absorb nutrients might result in failure to thrive for infant, damage to tooth enamel, weight loss, anemia, irritability, short stature, delayed, delayed puberty, neurological symptoms including attention deficiency, hyperactivity disorder, learning disability, headache, lack of muscle coordination, and seizures. Dermatitis herpetiformis, gluten intolerance can cause this blurry skin disease. The rash usually occur. Dermatitis herpetiformis, gluten intolerance can cause this blurry skin disease. The rash usually occurs on the elbow, knees, torso, calf, or buttocks. This condition is often associated with changes to the lining of the small intestine identical to those of celiac disease. But the skin condition might not cause digestive symptoms. Healthcare professionals treat determinitis, herpetimosis with a gluten-free diet or medicine, or both to control the rush when to see a doctor. Consult your healthcare team if you have a diarrhea or digestive discomfort that lasts more than 2 weeks. Consult your child healthcare team if your child is pale, irritability, failing to grow, has a pot belly, has foul smelling bulky stool. Be sure to consult your healthcare team before trying a gluten-free diet. If you stop or even reduce the amount of gluten you eat before your test for celiac disease, you can change the test result. Celiac disease tend to run in families. If someone in your family has the condition, ask a member of your healthcare team. If you if should be test, also ask about testing if you or someone in your family has a risk factor for celiac disease, such as type 1 diabetes.
Diagnostic test. Serology testing looks for antibodies in your blood. Elevated levels of certain antibody proteins indicate an immune reaction to gluten. Genetic testing for human leukocyte antigens can be used to rule out celiac disease. In the endoscopy, this test uses a long tube with a tiny camera that's put into your mouth and passed down to your throat. The camera enables the practitioner to view your small intestine and take a small tissue sample, called a biopsy, to analyze for damage to the villi. Capsule endoscopy. This test uses a tiny wireless camera to take pictures of your entire small intestine. The camera sites inside a vitamin-sized capsule, which you swallow. As the capsule travels through your digestive tract, the camera takes thousands of pictures that are transmitted to a recorder. This test is used in some situations where an exam of the entire or end of the small intestine is desired. If you're diagnosed with celiac disease, additionally testing may be recommended to check your nutritional status. This includes level of vitamins A, B12, D, and E, as well as mineral levels, hemoglobin, and liver enzymes. Treatment. A strict, lifelong gluten-free diet is the only way to manage celiac disease. Besides, with foods that contains gluten include barley, bulgur, durum, farina, graham flour, malt, rye, semolina, spelt, triticale.
Follow-up care. Medical follow-up at regular intervals can ensure that your symptoms have responded to a gluten-free diet. Your healthcare team may monitor your response with blood tests. Nutritional markers also are checked regularly. For most people with celiac disease, eating a gluten-free diet allows the small intestine to heal. For children, that usually takes 3 to 6 months. For adults, complete healing might take several years. If you continue to have symptoms or if symptoms recur, you might need to endoscopy with biopsies to determine whether your intestine has healed. Avoid packaged food unless they labeled as gluten-free or have no gluten-containing ingredients, including emulsifiers and stabilizer that can contain gluten. In addition to cereals, pasta, and baked goods, other packaged food that can contain gluten included beer, lagers, ales and malt vinegars, candies, gravies, imitation, meat or seafood, processed luncheon meat, rice, mix, salads, dressing, and sauces, including soy sauce, seasoned snack food such as tortilla and potato chips, sustain self-basting poultry or soup. Pure oats aren't harmful for most people with celiac disease, but oats can be contaminated by weft during growing and processing. As your healthcare team, if you can try eating small amounts of pure oats products. Many basic foods are allowed in a gluten-free diet, including egg, fresh meat, fish and poultry that aren't breaded, buttered coated or marinated, fruits, lentils, most dairy products unless they make your symptoms worse, nuts, potato, vegetables, and wine, distilled liqueurs, ciders, and sprites. Follow-up care. Medical follow-up at regular intervals can ensure that your symptoms have responded to a gluten-free diet. Your healthcare team may monitor your response with blood tests. Nutritional markers also are checked regularly. For most people with celiac disease, eating a gluten-free diet allows the small intestine to heal. For children, that usually takes 3 to 6 months. For adults, complete healing might take several years. If you continue to have symptoms or if symptoms recur, you might need to endoscopy with biopsies to determine whether your intestine has healed. Grains and starches allowed in a gluten-free diet include amaranth, buckwheat, corn, cornmeal, gluten-free flour like rice, soy, corn, potato, bean, pure corn tortillas, quinoa, rice, tapioca, wild rice. For coping and support, it can be difficult and stressful to follow a completely gluten-free diet. Here are some ways to help you cope and to feel more in control. First is get educated and teach family and friends. They can support your effort in dealing with the disease. Second, follow your healthcare professional's recommendation. It's critical to eliminate all gluten from your diet. Third, find a support group. You might find comfort in your sharing your struggles with people who face similar challenges. Organizations such as Celiac Disease Foundation, Gluten Intolerance Group, the National Celiac Association, and Beyond Celiac can help you in touch with others who share your challenges.
Nursing assessment for celiac disease. So first is clinical history. So to assess the clinical history, a nurse must obtain a detailed medical history of the patient, including the gastrointestinal symptoms such as unexplained weight loss, bloating, abdominal pain, change in the bowel habits, bloody stools, and more. Also, the nurse must assess the family history of celiac disease and check if the patient is associated with autoimmune conditions or diseases. Next is the dietary history. So, the nurse must assess the patient's typical diet to identify kung may sources of gluten ba sa kanilang kinakain, and also to evaluate the understanding of the patient to a gluten-free diet. Next is the physical examination. So, a nurse must conduct a thorough physical examination focusing on signs of malnutrition such as weight loss, muscle wasting, and nutritional deficiencies. The nurse must also assess the patient's skin kung may rashes ba or lesions. Clusters of itchy bumps or scabs may be dermatitis herpetiformis. Next is to conduct a laboratory test. So, a nurse must order and interpret laboratory tests
including serologic markers such as anti-tissue transglutaminase antibodies and anti-endometrial antibodies, and nutrient levels such as vitamins and minerals to aid in diagnosis and assess nutritional status.